Surgical diseases of the thoracic wall and thoracic organs. So firstly, there are two categories: closed injuries and penetrating wounds. Closed injuries are things like we've mentioned before, like hematoma, lymph extravasation, edema. We can guess why this happens. We've already mentioned this before. We've already talked about the characterizations, like some of them are quite doughy in feeling. And yes, you can inspect them and, you know, auscultate and things like that. But yeah, generally the treatment for all of these, just as a summary, is usually conservative, but you can do surgery. So like anti-inflammatories, antibiotics, blood transfusion in severe cases. But generally I would say anti-inflammatories, antibiotics, even analgesics are essential. Of course, diet and rest. Now we'll move on to the penetrating ones. We'll talk about pneumothorax first. This is quite a good picture, I think. So this is when there's a wound that penetrates the thoracic cavity, leading to direct communication with the environment. So there's a hole here, and there's direct communication with the environment, and you can see in this case it's actually resulted in a collapsed lung. What are the signs? You'll see agitation. The animal won't be comfortable. They can't breathe. You can imagine why in this case. Sweating because of the pain. Bloody foamy nasal discharge. Just something I learned actually for clinical examination. If you see bloody nasal discharge, it's because there's hemorrhaging in the lungs. You have to wonder why. Whistling noises from the wound opening, that's probably a dead giveaway. And later as well, if it's left much longer, they'll become lethargic, tired, depressed, even unconscious. So the clinical signs are basically related to what's injured as well. So if there's a rib fracture, they might have pain in the thoracic region. And you can have a number of, say, techniques, obviously, to diagnose it. You can use their history, look at the clinical signs, like the whistling is kind of a dead giveaway in endoscopy. You could treat it by surgery, so doing a closure layer by layer of the chest wall with multiple layer sutures. Thoracocentesis, so basically you could get a needle and basically remove any air or fluid, and drainage as well. So yeah, it's quite similar, to be honest. So it's taking out or lavaging the cavity. Next we have traumatic pericarditis. This isn't really a good way to show this, but it's usually in cows. So how does this occur? Usually a cow has swallowed a foreign body and it becomes lodged into the pericardium, causing infection. So what clinical signs can occur? Well, they can't really breathe very well because, as we know, when there's a problem with the heart, fluid accumulates in the lungs. They might be depressed, so tired. They might lose weight. You may see a submandibular or presternal swelling, so basically swelling around where the heart is. Swelling of both jugular veins, so the vessels are being affected. An axillary abscess, so meaning an abscess around the armpit area near the heart. And ascites, so fluid buildup in the abdomen. So we'll diagnose this by thoracopericardiocentesis. What's that? It's when basically you'll insert a needle in the 5th intercostal space. I kind of wish I had that picture now. Yeah, so imagine this is the 5th intercostal space, and you will aspirate any pus from the pericardium. And yeah, you can also do auscultations, radiography, you can do ECG, and in the ECG you'll see something called a coronary T wave. Don't know what that looks like, and I'm really sorry. But you can treat this in a number of ways. So you could do a transcostal or intercostal thoracotomy. So basically, you're going to give the animal a tranquilizer, because it usually occurs in cows, and a Novocaine cervical block, so they don't feel any pain in the area. Give regional anesthesia of the intercostal nerves, and then resect along the lower quarter of the 5th rib. So yeah, you would cut along the 5th rib. And a pericardiotomy, it's when you puncture the pericardium. I think this is a better picture. And you aspirate and remove any foreign bodies penetrating it. Then you would lavage it with saline and hermetically close it layer by layer with catgut. And what you can do is add a drain in the layer of the skin or the muscle with a sterile bandage, because of course we have some dead space there now. And afterwards you would make sure the animal has fluids, parenteral antibiotics, vitamins, a soft diet, and of course some rest.